Good morning. As a reminder, I'm Dr. Alina. Are you Mr. Smith?
Oh, yes, doctor, that's correct.
So, Mr. Smith, I can see from my medical history that your daughter suffered anaphylactic shock yesterday.
That's correct, doctor.
Is it correct?
Yes.
So, how are you feeling now?
Doctor, I'm still very worried. I just want to find out if my daughter is going to be all right.
Oh, I'm really sorry that you have been experiencing this situation. It's understandable to be worried and upset, and it might stress you out. So I can calm you, and I can say that your daughter now is recovering very well. We have administered subcutaneous adrenaline, and she now feels better than yesterday. And do you have any questions to me at this point?
Okay, yeah, before we drive the conversation forward, I'd like to quickly correct you on some few mistakes that you made. Okay, so now the first mistake that you made was that I'm sorry to hear that you have experience, right? So it's about the daughter, right? So I'm sorry to hear that your daughter um, had an anaphylactic shock that must have been very difficult for you. So it's just always better to use that strategy where you sort of echo the patient's words, okay? Um, Also, I think instead of saying, I want to calm you, it's better to say, I would like to reassure you that, or I would like to give you my words that we are doing our very best to make sure that your daughter recovers fully, something like that. So we have administered adrenaline. This is what you said. So I think before you get into this conversation, you could always sort of use this nice introduction. As part of treatment plan, we administered adrenaline to stabilize your patient, right? You don't have to really get into the physiology of what adrenaline does, okay?
Mhm.
Um, yeah, and then you can say that at this point, your daughter is stable, right? You can use the word stable instead of saying she is feeling well now, but you can say at this point, your daughter is stable, something like that. Okay, great. So, okay, doctor, I'm very happy to hear that my daughter is doing very well now. I just want to find out what could have caused these symptoms. Is it something she ate or drank at the party?
It's a very good question. I was just about to address it. Yes, you're absolutely right. Anaphylactic shock occurs usually due to food or drink allergens. And I suspect that at a party that was yesterday, she administered some allergens from food or some breweries. Is it clear for you so far?
Yes, doctor. Let me also quickly correct you here, right? Now, as part of clinical communication skill, we must do our very best to avoid any sort of medical jargons. Now, if you use a medical jargon, right, try to explain it in lay terms to your patient. So you told the patient that your daughter might have develop anaphylactic shock as a result of an allergen, right? So you can say allergens are chemicals or substances in the environment or in the food that can trigger allergic reaction. So you use the medical word, then you go ahead to explain it to the patient, right?
Mhm.
And also you said your daughter had administered, right, some allergens. We don't administer allergens, but we sort of inhale or ingest. Okay, so in this case, we suspect that it's a food or drink, right? It comes from food or drink. So you can say your daughter might have ingested some allergens. Okay, right. Okay, thank you, doctor. But how are you going to find out what exactly caused the symptoms?
So we are going to test your daughter to allergens, and after results we can see the confirmation of exact allergen that caused this anaphylactic shock yesterday.
Okay, so we are going to test your daughter two allergens. So the preposition you need here is for. Okay, so we're going to test your daughter for allergens. Um, okay, all right, doctor. Yes, I'm also concerned. Is she always going to have this problem?
Thank you for this good question. So I would like first of all explain you about anaphylactic shock. Uh, how are you feeling about this?
Okay. You cannot say how you're feeling about it, but maybe it's better to say, is it okay? First of all, I would like to explain to you, right? Not I will like, first of all, explain you. You always need to explain to you. That's what, like, just similarly, where you would say, listen to. So, first of all, I would like to explain to you what anaphylactic shock is. Is that okay? Right. Yes, doctor, please go ahead.
So anaphylactic shock is an immune response to chemicals, like we called them allergens from our environment. These chemicals can be uh, in our food or in our breweries, and anaphylactic shock cause narrowing of airways, and this leads to difficulty of breathing. And this immune response sometimes can be life threatening, unfortunately. Do you understand me up to this point?
Yes, doctor. Yes, thank you very much for that explanation. Is she always going to have this problem?
Mm, it depends. So many children can outgrow these allergies, and this immune response can disappear um, during her growth.
Okay.
And it's important to prevent from allergens.
Okay. Now, this is what you say. Many children can outgrow in these allergies, right? You cannot say can outgrow in, but can outgrow. Okay. Many children can outgrow these allergies, right? And I don't think it was necessary to say whilst they're growing, because to outgrow just means that when they're growing, it's going to go away, right? Also, I'm going to take you back a little bit. You said these chemicals can be in our food or beverages, can be found. Okay, so these chemicals can be found. So the verb found was missing. I think it'll make that statement even way better. Okay,
Yeah.
all right. Doctor, how exactly can I avoid this situation in the future, perhaps from occurring at the kindergarten or when my daughter goes to stay with friends or families?
It's crucial to inform your relatives or teachers in school about risk of anaphylactic shock, so they can avoid these allergens in her environment. Is it clear for you?
Yes, doctor, thank you very much. Now let's pay attention to the pronunciation of the word relatives, right? I think you have a little problem with where the stress goes. So you said relatives, right? Relatives. We say relatives, okay?
Relatives.
Yes.
Mhm.
Okay. Thank you very much, doctor. And if it happens again, what should I do?
So, if anaphylactic shock occurs, it's vital to see to seek medical advice and to use immediate medical auto injector with adrenaline. It's called EpiPen.
Hmm. Okay.
We are going to prescribe, and you can buy this auto injector.
Okay. All right. Just don't say
Any other?
we are going to, but I am going to prescribe, right?
Mhm.
Because you're the only doctor in the room, so I am
Yeah.
going to. It's better. Okay. All right, doctor. Thank you very much. How are you going
Before
to?
we conclude our consultation, I would like to know if you have any other questions.
No, doctor. I do not have any other questions.
Thank you very much. Feel free to contact us if you have any difficulties.
Hmm. Okay. All right. Thanks. Bye bye.